Hi, my name is Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane. I'm going to talk to you today about the risks and potential complications when considering having frozen shoulder surgery. So what we're talking about is frozen shoulder or adhesive capsulitis. They are the same condition. And we're talking about surgical release, that's an arthroscopic release of the capsule to give you back your range of motion. So these MRI scans are helpful in considering frozen shoulder. So this is a more normal scan here. What we're seeing here is the humerus coming up, the ball, the socket, the shoulder blade is there. That's the AC joint. This is skin, this is deltoid. This here is the neurovascular bundle. That is the vessels, and then the nerve is just here. And you see that little black line there? That is the capsule of the shoulder. And that is what's affected in frozen shoulder. It becomes inflamed and then becomes thickened and fibrous and contracted. And that's the second phase. Third phase gets better and goes away. What we see with this MRI scan is the capsule here is quite thickened, markedly thickened. What's more, it's brighter, it's lighter in its signal. And outside of it, the white there is fluid. So there's fluid sitting outside the capsule. It's an inflammatory condition of the shoulder, so there's fluid around the shoulder. And we see that also up in the bursa here. Between the tendon and the outer surface of the deltoid, there's a streak of fluid there, and that is fluid in the subacromial bursa. If you've had an ultrasound early on, that will normally be reported as showing bursitis. It's not. It's fluid in the bursa, which is interpreted as bursitis. You've got fluid there because the shoulder's inflamed because of the frozen shoulder, rather than having that other common condition, bursitis. Now, what I tell patients is you need to consider the risk of infection, so that's very low, 1 in several hundred. There's a risk to the axillary nerve. The axillary nerve comes round underneath the shoulder and goes to the deltoid muscle, very important muscle, and it's right beside the capsule which we're cutting, so it's obviously at risk with the surgery. DVTs, hematomas, wound issues, all of those things can happen with any operation. And of course you have an anesthetic and there's a risk from the anesthetic. Now let's put some science behind that. These 3 articles here, these are scientific publications, are systematic reviews and meta-analyses. They've looked at large numbers of publications dealing with frozen shoulder and the outcomes of frozen shoulder and summarize the findings. If you'd like to go to any of these articles, just scan that QR code. It will take you directly to that scientific publication. What they found is the complication rate of frozen shoulder ranges between 0.5% and 4%. Dealing with persistent pain in 1 to 2% of patients, infection rate was quite low at 0.5%, and it was described as impingements showing up in 0.3 to 1% of patients. So risks are quite low. I've got 2 publications. This is the actual technique that I use. We published in 2021, and then this publication in 2024. We looked at 50 consecutive patients that I operated on. We found no complications in that group of patients. Now that doesn't mean that the operation has no risk. Of course it does. What it does suggest, however, is that the risk is very low for this operation. So that's an overall view of the risks and potential complications to consider when coming up to having a frozen shoulder release. Thank you for listening.